Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Get CME for this episode by clicking on the CME link in the show notes. Today, we welcome Mossi Salibian. He's a plastic surgeon. Today's Kevin MD article is titled Top Tips to Find Success as a Plastic Surgeon, according to an industry veteran. Mossi, welcome to the show.
Thank you, Kevin. Thanks for having me on the show.
So tell me, what are some of your motivations to going into plastic surgery?
Well, first of all, it was, as you know, I love sciences. I was interested in life sciences more than anything. And plastic surgery was more, it allows you to, once you've understood the foundations of medicine, anatomy, and physiology, it allows you to be more creative as far as ways to do things, as long as you understand the basics and what will work with different types of challenges and different ways of presentations that you're faced with versus, let's say, surgical oncology or urology, which is more based on algorithms for specific cancers and their stages. Whereas the reconstructive aspect, it does allow you to be more dependent on your own creativity, like what is the best way for this specific situation to reconstruct. Could it be a breast, or could it be facial squamous cell cancer that's been extirpated? So there's different options to be able to serve in your specialty. And it allows you to connect. You know, we see patients for a long time, not just for the consult, but the surgical oncologist, let's say, does the procedure and they see them a few times when it's healed. But as plastic surgeons, we see them for a much longer period because a lot of our surgeries may be staged. So we connect with people, we connect with the family. So it's a totally different game and way of practice.
So you are a successful plastic surgeon, and your Kevin MD article is titled Top Tips to Find Success as a Plastic Surgeon, according to an industry veteran. Now, tell us, how did your article come together?
It's amazing how years have gone by. It's been 22, 23 years already. And so, you know, one of the basics, as we all learn in medical school, how to be empathetic and listen to patients, those foundations that we learn, or you have to have it in you also, right? We all choose to go into medicine because we want to help people and be compassionate, and you know, they're in whatever ailments they present you with. So in plastic surgery, there's a lot of, you know, you're dealing with patients' self-esteem, their sense of what bothers them and why. So basically, it's a quality of life. You know, we're not saving lives as a trauma surgeon would, or, you know, oncology surgeon. We're helping with patients' quality of life. So you need to be able to listen and understand where the patient is coming from, what issues bothers them, you know, first, second, third, and how much of those can we really address and allow to understand their level of expectations. Some people think that we can transform like completely, and you know, they may be in their late 60s and they think they may want to look in their 20s. You know, some things are just not possible, or could be not just the face, but body parts too. So we need to understand their expectations and how to navigate that journey.
Now, plastic surgery is one of the fields that you see more on the internet than other physician specialties, right? And from a patient standpoint, when they're bombarded with just so many advertisements from plastic surgeons on social media and on the internet and from Google, how can they make sense of who they should go to? What kind of questions should they ask to know who is a reputable plastic surgeon or not?
That's a great question. So you're right, people are bombarded, and a lot of it is because of the marketing, and there's the monetizing of cosmetic procedures, and a lot of it, I think what you're getting at, is also performed by people who are not trained. They don't have the traditional residency training in plastic surgery. We see, you know, primary care physicians where the companies who make like laser lipo, for example, right, or things that are minimally invasive, and they advertise to the non-trained subspecialties because, oh, it's easy to do, you don't need anesthesia. So patients don't really know, should I, and they advertise heavily. So patients are confused. Oh yeah, it says it's the best, liposuction surgeon or liposculpting and things like that. So what patients need to understand is it's very much easier now than, let's say, 20 years ago, or every technology is advancing so fast. So there's really no excuse not to research the physicians and not rely only on their marketing of what they say that they do. So you can look up patients, first of all, for certification. What have they trained, and what they're advertising, is that congruent? Have they trained in plastic surgery? Have they graduated? And do they have their boards? You may take a few years to get your board, that's fine, but have they done the training? At least that's a minimum. And then you want to look at the experience depending on the procedure you're having done. Some people may not think that the breast augmentation is a simple, so you have non-plastic surgery doing breast augmentation, but if one were to have a complications can happen with the best of hands. So they need to understand that they're trusting their body, somebody who is experienced and knows there's a plan A, B, C, and D should there be an issue. Because we see as plastic surgeons complications that are done not just overseas, people come with infections,
Yeah.
but with the wrong size implants, the wrong plane of dissection, asymmetries, all types of problems, and they're done by people who are not trained. It's easy to look people up, but the bombardment of advertisement, they need to be able to weed it out. And so look at the American Board of Plastic Surgery. It's a whole website that tells you each candidates, when did they get certified, and if they're, then there's also recertification every 10 years. So that's one. Looking at the plastic surgeon's website to see if they're members. So those are some of the basic things. And besides looking at their credentials, whether they went to school. And then as far as experience, you have how many years of practice. I would say 5 years out of your training. Even I finished fellowship, right? So there's total of 8 years in the surgical residency program, 5 years general surgery, 2 years plastics, 1 year. So lots of surgical training, but it's still the first 5 years after your residency, probably in any specialty, is really your own private sort of fellowship where you're seeing patients from all walks of life. So the experience does count for surgeons. Yeah. And then the last thing I would say is talking to the patients that a physician, a lot of the best I would compliment I have is patients volunteers to talk to other people and even meet them. So that is a great thing. It's not just what they say. You can, after the consult, people can ask, I would like to talk to them. Is it okay to make a call? And some people may even volunteer to meet with them. So that's important.
You said earlier that one of the secrets, I hate to say secrets, because it's not really a secret, to your success is listening to patients. So, in the context of plastic surgery, I know that there's a lot of psychological components as well for people who come to you for plastic surgery cases. What are some specific ways that you can show that you're listening and address some of these accompanying psychological concerns?
Great question. So you need to be able to understand, is it a complex issue, or is it, so basically help them navigate what is important and how to correct a deformity, let's say, or how to improve an appearance. Is it cosmetic, reconstructive? So a lot of the times it is actually combined. We do both functional work. Let's say if it's a rhinoplasty, some people cannot breathe. So we basically dissect the issues that the patient presents with, explain that to the patient, like this needs to be, we can address this and that and not the other
Mm-hmm.
third issue that they're presenting with, which is how you gain confidence, because you're taking your time, you're explaining surgical nuances with timing based on their medical presentation. And then we always ask to come back for another consultation to work and to establish a better rapport if they need to.
Now, tell us some tips that you could share with other plastic surgeons and surgical subspecialists on how they can maintain their success and longevity. So, any tips from your own experiences that you could share with other surgeons?
I think, yes, one of tips I would say is to stay in touch with your patients.
Mm,
Just because they had surgery, the practice manager in practices, they in their training, there's, when they book a patient and book and like it's done.
hmm
So there's a term like to follow, to book, and actually not because they, it's not just more that they had the surgery, it's to follow up with them also. So that's important. You never know where your referrals come from in subspecialties at any time. So I've had a referral from a pathology a technician in pathology, just based on the specimen for breast reduction that he received. He had told his mom that, you should go see Dr. Salibian because every time I get specimens from his breast reductions, they're just so nicely, like they know which part of the breast the specimen came from. So you never know where your referrals come from. So you need to keep an open mind, you know, be respectful when you're out in the community, be engaging with people, and have an, be available. In surgical specialties, availability is key. So your phone, your office, it's so annoying when you call some practices and it's a recording and then somebody answers who
mm.
is answering for three other people. It's not personal. So you need to be availability, personable, and your staff needs to be well versed in what you're offering to your patients, regardless of what type of plastics you're practicing. Because some people just do breast, some people just do nose, some people do everything. There's hand, so they need to be able to talk about, not, I'm not saying clinical things, but at least be able to engage and have a conversation with the patients.
We're talking to Mossi Salibian. He's a plastic surgeon. Today's Kevin MD article is titled Top Tips to Find Success as a Plastic Surgeon, according to an industry veteran. Mossi, let's end with some take-home messages they want to leave with the Kevin MD audience.
The most important thing, as we talked about earlier, is listening, be engaging with the patients, manage their expectations, offer the best that you can offer given your resources as a plastic surgeon. Make sure that all the safety modalities are checked and double checked, from as simple as when you do pre-op clearance, that we do pre-op clearance for everyone,
Mm-hmm.
regardless of age and how they present. Obviously, if someone's older, they have history of cardiac issues, they get full cardiac clearance. But my point is, you need to follow the patients pre-op, peri-operative, and post-operative, and check everything. We're first as we are physicians, so we make sure patient is healthy medically, psychologically, mentally for procedures. And remember, a lot of it is elective. Unless I did a lot of trauma reconstruction in the beginning of my practice, but a lot of things we do, even breast reconstruction, can be elective. So patients have lots of options. So you need to navigate the journey with them at the right time, always having patient safety as a forefront. And then executing your procedures well, having always plan A, B, and C in your mind ready should you be presented with a unforeseen situation. And then you all have complications. In surgery, we say the people who don't have complications are those who don't operate, right?
Mm-hmm.
So it's how you deal with the complications. We've had complications, and it's interesting. Patients who have had complications have referred their loved ones. So it's how you dealt with that complication. So it's not the end of, it doesn't mean your end of your career. It's not like a performance artist that they have this bad, day, and so people do give us second chances, and it's very humbling, and it's a profession that you grow with. So keep your academics up to par.
Thank you so much for sharing your story, time, and insight. And thanks again for coming on the show.
Thank you, Kevin. It was a pleasure.